Dr. Brian Prax of Chronic Care Charlottesville is visiting with us. And a long time ago, we talked about the stereotype, perhaps outdated, outmoded, of the chiropractor as just somebody who says, I'll straighten you out and then be back in a week. But that's never what it really was. You work, in some cases, with people with chronic conditions that you just have to manage. But there are other people that you work with that are healing while taking the chiropractic visits and can eventually, be to the point where they're better, as it were.
Well, let me speak just towards chiropractic in general. It can be analogous to a stretching regimen. It can be analogous to physical therapy, to yoga, to Tai Chi, to doing, maybe even taking vitamins. Sometimes you do need to do things on a very regular basis. And if somebody comes in with a torn up back, a work-related, a car accident or something like that, Joe, they may need to come in more commonly. So I just want to speak toward chiropractic and some of these other modalities. Sometimes that is necessary. Okay? Right. Even medications. You have a prescription for antibiotics because you have an infection, right? So the doctor says, look, you don't need to come in 3 times a day, but I want you to take this pill 3 times a day, and you're going to take that for 2 weeks. So kind of analogous to that. But in our office, yes, I am a chiropractor, and we're using techniques even outside of the chiropractic profession to help correct underlying problems. And Joe, we've really re-engineered our programs for our chronic conditions like neuropathy and knee pain to where a patient is coming in 2/3 less than what they are. And the way we're doing that is with technology. We're in the era now of internet, Skyping. For instance, I have a patient who's consulting me from Florida. I'm in Charlottesville. I've never met her other than we Skype. We're on the phone. We're emailing back and forth. With
so you're
technology.
Consulting exercises that she can do.
Exercises, brain-based therapies. We're sending her certain modalities and tools that now with how fast the UPS and mailing system is, we can send her stuff. I can consult. And we're getting great results even from people who are what we call remote and not far. For our local patients, instead of coming in 2 or 3 times a week, we're actually able to do it much, much less. And now, Joe, we're getting better results. It's really exciting.
Well, how do they get in touch with you, Dr. Prax?
One of the ways you can do is by calling, and the number is 977-5433. Also, chroniccarecharlottesville.com. And I also want to say we got a great YouTube channel. And just Google YouTube Dr. Prax, and that's a great way. We've got over 300 videos on there that your listeners can listen to.
Well, thank you very much, Dr. Prax.
Thank you.
Chronic Care Charlottesville.
Yep.